Hey everybody, it's Dr. Dave Psychiatry. Thanks for coming to the YouTube channel today. And again, reminding you that if medicine fixes what's wrong with you, that makes that a medical problem, not a mental problem. So talking about medicine today, was asked by a patient recently, hey doc, what's really the difference between Xanax and Ativan and Valium and Klonopin? And so I'm going to do a video about that today, and I hope it's helpful to you. If you're taking one of these medicines, you might have already seen a video about what I call GABA boosting. So the class of medicines called benzodiazepines are medicines that interact with the benzodiazepine receptor in your brain and thereby increasing your GABA activity. And when you have low GABA, if you're here, typically that causes either terrible anxiety or often associated panic attacks, often associated with agoraphobia, which is fear of the marketplace. Scared to be, shopping because you might have a panic attack. So we routinely use this class of medicines as GABA boosters. So again, if you are supposed to be here and you're here, these are medicines that boost your GABA and help you to feel better. So really, what is the difference between them, and why would you use one preferentially, one or the other? So what I tell people sometimes in the office when they say, hey, what's the difference between Xanax and Ativan and Klonopin and Valium, is the rhetorical question, or the response question, what's the difference between a Chevy and a Ford and a Chrysler? Well, you might not even know what a Chrysler is, but the fact is, Chevys and Fords, and maybe a Dodge, and if you're talking about pickup trucks, a Chevy and a Ford and a Dodge are just different trucks. They're all trucks. Does that mean that they are all the same? No. Do they perform the same function? Pickup truck typically is a pickup truck. So even if it's a Nissan, it's a pickup truck, it's got a bed and it's got a cab. So these medicines that we're talking about, the GABA boosters, a lot of times I think of them just as sort of the same, but technically different. A way to look at medicines, as we've talked about before in some of the videos, is that a medicine, which is actually a molecule that fits into a receptor in your brain, is sort of like a key. It's got a certain shape to it, it's got a certain length to it, and it's got certain cuts in it that make it fit in that lock. So even though these medicines are technically different in terms of their actual shape, their molecular structure, how they're built, they are distinct, but they act all in a similar fashion by interacting with the benzodiazepines. So technically, are they different? Absolutely. In the same way that you've got 4 different keys in your pocket that are shaped 4 different ways. Do they do the same thing? Well, no, they all fit into one lock. In the way to think about them, the way I think about them and teach my patients, is that they all boost GABA by interacting with the benzodiazepine receptor. So at the same time that they're different, they all function the same way. Now, does that make them the same in all people? Absolutely not. So again, now we're back to the analogy of, if you are, I guess we could stick with the trucks, if you're talking about a pickup truck, what makes Xanax better for one person than Valium? And the answer is nobody knows. Nobody really knows how these medicines work in the first place. But you can take one person who does terrible on Klonopin and does great on Valium, or somebody does great on Xanax but does terrible on Valium, and you don't really know until you try. So again, troubleshooting brain chemistry, when I'm working with people that have low GABA, I want them to have a good trial at proper doses of a medicine until we decide if it's good or not. As a class effect, a lot of people who don't do well with any of these medicines, if they make you tired, if they make you sleepy, if they make you drowsy, those are all a class for all 4 of those medicines that make them, difficult to use for some people and sometimes just flat impossible. Those are the big 4 that I use: Xanax, alprazolam, Ativan, lorazepam, Valium, diazepam, Klonopin, clonazepam. All those ending in PAM, they indicate that that's what they do as GABA boosters, as a class of medicines. And the common problem, as I just said before, is most oftentimes sedation. But that doesn't mean that if you are super sedated on Xanax, that you're going to be super sedated on Klonopin. You just never know until you try it. One of the things that they do have in common is they do have an addictive potential if used beyond the addiction threshold. So addiction doesn't mean that you would benefit from the medicine. Addiction means that you have to take more and more over time, and that when you don't have it, then your body becomes sick. Not that your anxiety comes back, but you actually have withdrawal symptoms. And generally speaking, the threshold for these medicines is about 4 milligrams per day for more than 3 months. So the guardrails that we keep in place typically for Xanax, Klonopin, Ativan, and that class is typically 4 milligrams a day, because Valium is a lot less potent. So the rough equivalent of 1 milligram of Xanax is 10 milligrams of Valium. So roughly speaking, 40 milligrams of Valium is about the upper limit of what typically is used in practice. If those are slightly beyond what are the FDA approvals, obviously off-label, we are able, as doctors, prescribers, we're able to use the amount that we help people, but we don't want to violate that guardrail, because once you go beyond the guardrail for any extended period of time, you may have trouble with addiction, tolerance, and having a difficult time getting off the medicine. As far as them being controlled substances, that depends on the state. These are controlled in my state that I practice. If you're thinking about that, you have to look at, are they controlled in your state? I think, honestly, universally, I think in the United States, these are all controlled substances, but that's something I would have to ask you to verify if you don't know in the state that you're in. As far as the medicines being dangerous or scary, that's a lot of idea that people say, hey, I don't want to take those medicines, they're dangerous. Well, as I've gone through before in other videos, the real danger in these medicines is when people take them and they should not be taking them. That is to say, if your GABA should be here and your GABA is low, then boosting it with medicines that we just are talking about here, Xanax, Klonopin, Ativan, and Valium, if they boost your GABA to normal, then that should cause you to feel normal. That is to say, the absence of panic attacks, the absence of agoraphobia. You should feel less anxious, because if you're low, you're going to feel a lot of anxiety. If you're here, you're going to feel a lot better. But if you start here and you have normal GABA and you take a GABA booster like Xanax or Klonopin or Ativan, if you go above where you should be, then typically that's where people feel drunk, intoxicated, and that's where people use the benzodiazepines as a party medication. So when people say, hey, that Valium or that Xanax, I know people that got addicted to that stuff. Well, typically that story means they shouldn't have been on the medicine in the first place. When used properly in the right prescribed doses for people that really need it, Xanax, Valium, Klonopin, and Ativan are all good tools to boost GABA for people who need them. So, last thing is to say, if you're taking these medicines and you drink alcohol, well, again, a lot of doctors are going to say to you, you should not use medications and alcohol at the same time. What we find is that when people are on these medicines and they do have a drink, that one drink may feel like 2 and 2 may feel like 4. So if you are taking this class of medicines we're talking about, the GABA boosters, you ought to be very, very mindful of how you feel if you have a drink, even if it's against doctor's orders. If you decide to do that, that's something you need to be very aware of, that one drink may feel like 2 and 2 may feel like 4. So how are these medicines different? Are they all the same? Well, technically speaking, they're completely different, but in terms of practical usage, they're all very similar. And in the same way that when you go buy shoes, you don't just decide, well, I'm just not going to try shoes on because I might have a problem, or I had a problem when I tried on shoes before and that didn't fit. So for example, if the Xanax didn't work, well, that means I can't take any of the others. The truth is, if one pair of shoes doesn't fit you, the next pair of shoes may fit you very well. So in practice, when we're helping people that have terrible problems with low GABA, which is leading to anxiety and panic attacks, in practice, if one doesn't work, it's totally fine and proper to try the next one and do another trial and another trial and another trial until you find the one that works for you, until you find the shoe that fits. So that's my response to the patient's question. Hey, are all these just the same? No, they are not. But in practice, a lot of times they are used for the similar condition. I hope that's helpful to you. I'm glad the channel is helpful to a lot of people, getting a lot of viewers these days. So it's indicated that things are going well and we're helping you with the information. So happy to hear that. So that's all I have to say today about this class of medicines. I'm Dr. Dave Psychiatry. Thanks for coming to see me.